So good morning, everybody. I hope everybody's doing very well today on a Friday. So before I begin, let me just introduce myself. My name is Jonathan Ong, and I'm the Senior Health Manager for the Informatics Program for Mecklenburg County Health Department. And then Frank.
Hi, my name is Frank Diaz-Garelli. I'm an assistant professor of health informatics at UNC Charlotte. Work closely with Jonathan Ong and very excited to be here.
Thank you very much, Frank. Let me just start my screen sharing, and then we'll begin from there, okay? Very good. Thank you very much. So just before we begin with the presentation, we'd just like to remind everybody that this is a very interactive session. And the charge for us at the end of this particular session is to really come up with ideas, and just like what Dr. Michael had said earlier, to innovate and think outside of the box, right? So for us to create a brief and bulleted set of priorities, strategies, and need recommended to address the underlying social determinant and structural behavior barrier. So what we plan on doing, Frank and I, is that we're going to have a couple of breakout sessions throughout the presentation, so that we'll be able to come up with the recommendations that answers the three Ps. So, and this will talk about the people, the process, and the product. And as we put things into perspective, we'll be able to have these different breakout sessions that will address these different things. So, if there's no questions, and Teresa, you think we are ready to begin, I'll start off with the presentation. Okay, so I'm going to start off with a quote here by Dr. Karen B. DeSalvo, who really pioneered Public Health 3.0, where she said that Public Health 3.0 recognizes that we need to focus on the social determinants of health in order to create lasting improvements for the health of everyone in America. And I think that's really one of the main goals of our discussions today throughout this particular AFI Nexus. And that really what drives us in terms of understanding what we need to do with regard to Public Health 3.0. But when we talk about social determinants of health, and just a quick review of what that is, what does Public Health 3.0 really ask us to do? Public Health 3.0 calls us to boldly expand public health to address all aspects of life that promote health and well-being. That includes economic development, education, transportation, food, environment, housing, and safe neighborhoods. And what you also see here on this particular slide are the essential public health services that we need to be able to provide. But the biggest question there is that, so how? And so we know what it is, but how do we achieve that? So in the guidelines and framework of Public Health 3.0, there are three key themes that we need to understand. Number one is strong leadership and workforce, strategic partnership, flexible and sustainable funding, timely and locally relevant data metrics and analytics, and the foundational infrastructure that needs to happen within Public Health 3.0. So within this five different key themes, let me just give you a few examples of what has happened over the past 12 months here on Mecklenburg County in terms of how we have addressed and met Public Health 3.0. So I'm going to start off with back in July, when the CDC director, former director, Dr. Robert Redfield, visited Mecklenburg County Health Department. A lot of these key themes were basically reinvestigated and rejuvenated because of the response that we had for COVID. So what we need to address here is that, one is that there's strong leadership and workforce. And if you have not seen the news, or if you have not seen any news briefings, you will not be amiss of Gibby Harris being on the news, making sure that everybody is informed of what's going on. And that strong leadership within public health right now is what we have seen under Gibby's leadership. And then the next bullet point here is strategic partnership. The COVID response from Mecklenburg County is not done just by public health doing it all alone. We had strong partnership, and we were in constant communication with the big hospital systems, with community organizations, and so forth. And of course, flexible and sustainable funding, which we'll discuss later on in terms of where we are with that. But there were funding that was made available to us that made a lot of things workable for our response. And of course, the biggest piece here is the timely and locally relevant data metrics and analytics. Gibi did mention during her opening remarks about how important data is, but of course, data is just data if nobody puts action to it. So um, relevant data is very, very important. And of course, the foundational infrastructure, which I believe here in Mecklenburg County we have established over the past couple of years. So to continue on the discussion, now that we understand what the vision is of Public Health 3.0, we're going to go now next to what it is for Mecklenburg County Health Department and what the Public Health 3.0 has happened here at Mecklenburg County. One of the things that I would like to point out that is that this particular slide is just a summary of what has happened and are taking in shape as what we're experiencing here in Mecklenburg County. And as we know, over the past 12 months, we've been interrupted by this so-called virus called the coronavirus. So a lot of the work that we're doing has actually been put on hold. But one thing that I would like to point out is that here in Mecklenburg County, during this pandemic time, we've actually highlighted all of these needs and all the work that we've actually put in to address Public Health 3.0. So one of that is infrastructure. We now have data lakes, data dictionaries, and we now have data stewards that actually understand what the data is within our system. One of the other things that we have addressed within Mecklenburg County is skill building. One of the things that we did address over the past 3 years now is that we are starting to optimize systems, and not only we're optimizing systems for the clinical piece, but we're optimizing systems for all kinds of services, including environmental health, our communicable diseases group, and so forth. The biggest piece that we are working on is on data governance. And one of the things that we did work on with AFI the past year was the data across sectors of health, which provides us with a foundation of what data governance is. So we now have an idea of what data quality means for Mecklenburg County. We now have some analytics that we're able to draw out from all of this data. And of course, the biggest piece that I would like to point out is data sharing. We now have a stronger data sharing platform that will be able to share data and take data from organizations outside of the health department. And of course, in the next coming months within Mecklenburg County, we are actually moving towards staff development, where we're actually providing more of leadership training, staff engagement, to make sure that how we understand Public Health 3.0 is how we also bring it up to the staff who's actually going to implement this kind of things. So this is just a slide that I just want to share with everybody, which I think summarizes what it means to have that Mecklenburg County approach to Public Health 3.0. One is that Mecklenburg County has been a key strategist in a lot of the response that we've had over the past 12 months, right? And that's one of the main highlights of Public Health 3.0 is for the local health department to be the key chief strategist in terms of how we approach the things that need to be accomplished within public health. The other things that we have actually that this particular slide's almost sort of like addresses is that we have developed key infrastructures that allows us to develop systems to help with the response. Mecklenburg County IT has done a tremendous effort to make sure that we have been provided with the infrastructure, with the equipment to be able to address as soon as the pandemic hit. And we're able to actually develop systems that will actually gather data with our COVID investigation, with our COVID hotline, with even with our vaccinations response. So we've done a huge bit on infrastructure the past 12 months. But even before that, we have started developing data lakes and data dictionaries that provides us with access to data so that we'll be able to not only keep the data, but also take data out for analytics. The other key components of Public Health 3.0 that's been highlighted here in Mecklenburg County are the partnership. We have partnered with Novant, with Atrium, with a lot of community organizations, including faith-based organizations. We have partnered with StarMed for our vaccination administration support. So a lot of this partnership help us um, deliver all the services that we need, not only for the clinical response, but for all the other responses um, through social workers and so forth. One of the biggest key things that I think was highlighted in today's opening remarks were about data. In one of the keynote presentations, they did speak about the three principles of action driven, and one of that is making sure that we have access to data. And of course, the last one here is on on public health 3.0 that's been very much highlighted within Mecklenburg County is sustainable funding. Back in July, when Dr. Redfield, the CDC director, came to visit Mecklenburg County Health Department and looked at how we were able to address our COVID investigations and how we were able to address and take care of the community as a whole. One of the things that were highlighted during the conversation was that not only did we have great access to data, but having that information flow down from federal to the state that includes sustainable funding. One of the key recommendations that was presented to Dr. Redfield was the fact that we need to have funding not only for during pandemic when the pandemic happened or when a disaster happened, but funding that will be ongoing so that we don't simply create something because there's a need for it, but we are creating something in preparation for all of these different scenarios. So I think this particular slide addresses it all when it comes to process, funding, infrastructure, and the partnership we have with the different organizations. So I guess we're ready for our next part of our presentation. I'm going to turn this over to Dr. Frank for the response of UNCC, Public Health 3.0.
Thanks, Jonathan. So basically, what I wanted to do with this part of the presentation is to give you a little bit of an understanding of what we're doing at UNC Charlotte to support the Meg County's health department efforts to bring about public health 3.0. AFI is its integral mission is about building healthcare 3.0 in the Mecklenburg County. Um, the idea is to strengthen cooperation, coordination, exchange of resources to help this uh, come about. The idea of having innovation in AFI is because building public health 3.0 is going to require a lot more than resources and using the same tools that we've always done. So what we try to do at AFI is bring people together so we can think outside the box and build this ideal of public health that goes way beyond what we've seen before. For those who have a public health background, you remember the example of using plotting data to geographically to understand the distribution of a disease to understand where the source is. Well, that was innovation at the time because nobody had ever done it. So what we're trying to do with these meetings and everything we do at AFI is trying to find the new ways that are going to unlock us to build systems that will allow us to take care of people at the community level. So the mission of AFI is to develop solutions to address Charlotte's area's most pressing community health needs. And the way we do that is doing three or four things, out of which I picked three. Um, so supporting implementation of evidence-based community health practices, uh, com- coordinating training programs and professional education, and expanding the ability to systematically collect, analyze, and interpret health related data. The subtext here is that most of what we do at AFI is data related. If it's not data driven, it's data supported. And if it's not neither of those two, which is really rare, it's going to be evaluated through data. If we go to the next slide and look at a screenshot of the AFI project page, we have the four top projects that we have here are data driven, and here's why. The HIV prevention efforts that we're doing are based on tracking and monitoring of data that describe the patients, and a lot of what we're doing is trying to do surveillance of outbreaks that are based on data and creating dashboards that are meant to turn raw data into actionable insights. If we look at the effort that is geared toward integrating data across sectors of health, uh, that's basically using integrating data so we can see more through what we already have. Building uplifted family is also a data driven effort, as it slide. So that one is not necessarily data driven. That one uh, is more supported by data through the development and through its evaluation. And the healthcare hackathon is basically a bunch of people from Charlotte and the Mecklenburg area looking at solving data problems to enable healthcare. So this is just a reminder of what we're doing at the UNC side, but showing you how data is important. And this is just a primer for us to start thinking of how we can make this data orientation a little bit more natural to all of us, even if your job, especially if your job is not about data. We really need to get people who are out in the community and people who are clinically oriented to at least understand what their information needs, so the data people can support those things and help you do your job even better by having better information. So Jonathan, I think you've got the next slide.
So this one is about so this particular slide now talks about that data driven is not just all about technology. And I don't know if Dr. Frank, you have some thoughts on this with regards to what this actually means to us. And I think this is one of the things that we would like to have a bigger discussion during the breakout, is that
Absolutely, yeah.
is a discussion about being data driven, and the culture of being data driven is not just all about
So
technology, the high
I,
tech stuff,
I,
right?
I do have a few examples because this is part of what I teach, but data has so here's the thing that a lot of people may not realize. Data has nothing to do with technology. I mean, if you consider pen and paper technology, sure, it's always technology driven, but the idea is that data is just raw information or pre-information. It's just basically accounting for what's happening out in the world. And it doesn't have to be based on a smartphone. It doesn't have to be based on a database. Uh, Actually, paper records are a great source of data in the clinical setting. And that doesn't really require much technology. Of course, if you have a million patient records, you need to have a system uh, to keep that information organized. However, it's not something that people would consider low tech. Being data driven on the flip side is making sure that you're recording what's happening so you know what happened in the past, so you can study it and make better decisions in the future. So what we're trying to get at when it comes to data driven, it's more of the idea of making sure that we're recording what's happening so we can both look back and see what happened and look forward and evaluate how we're doing. Does that kind of go in the direction you were thinking, Jonathan?
Yeah, that's correct, Dr. Diaz. So with data driven, one of the things that I mean, here, especially in Mecklenburg County for the informatics team, is that data driven is not just all about the bells and whistles of a high tech new equipment that we could have, but it's really more about the the way of how we think about how we're doing our work. Are we able to capture data as we're doing the work so that we'll be able to report that out? Yes, pen and paper is a great source of data, but in today's time, we need to also think about how we can easily share that data to people, how we can easily analyze that data. And sometimes it's not about the fancy, the databases and all these different things that most of you might not really understand, but it's really about the thinking of, are we capturing data? Are we saving it so that we'll be able to extract data later on for future use? So one example of that will be, for example, for our COVID investigation. Initially, we did not have any cases here in Mecklenburg County, but we know that potentially it could go through a process where at the end of the day, we know that we need the data to be able to analyze what our next steps would be. We know that public, the media, wants to hear what our data is. We know that even for Mecklenburg County Health Department, our commissioners need to have data so that they'll be able to help provide guidance with how they're making decisions. So whenever we're thinking of what we're doing, we're also thinking about how we're capturing the data as we go along.